So today's conversation is around health, and we're excited. We have a guest, Nambi. I'm gonna let you. Oh, you got your little guy with you. Oh, he's got the boss.
Yeah, sorry, Jay. We were supposed to hand off to my wife, who's in the other room in another meeting. There she comes. All right, say hi and bye.
Hey, buddy.
All right. How
Um,
are you guys doing?
okay, so today we're going to talk. We're talking about health, and appreciate Nambi is in charge of strategic planning for IU Health. Is that right? I always get it. Okay, I
That's
finally got
correct.
it right.
Yep.
And has served in here in Indianapolis for about 4 years.
Three going
Three.
on four. Yep.
And was in New York City, so he moved here to get away from traffic, right?
That's right.
Yeah.
That's right.
Well, we are hosting these meetings yesterday and today about the 6 external focuses, and so I have some very specific questions for you, and you deal with these. Can you explain to folks today, and I'm moving forward into this, and I'll introduce some of our team later because Nambi's on a tight schedule. What are the social determinants of health? We talk about that, but what are they?
Yeah, yeah, it's a good question, Jay. So I prefer to think about, I prefer to actually call social determinants of health social impediments of health. The reason I say that is because these are, you can think of these as factors that are outside of the core care delivery realm. So if you think about hospital or clinic setting, these are factors such as, transportation, where you live, where you work, where you play, that actually impact up as much as 80% of our health and well-being. So I think, when we health professionals or others, when we talk about social determinants of health, we're really talking about the environment where people are born, where people live. If you haven't completed, for example, we know children that are born to parents who haven't completed high school are more likely to have barriers to health than others who have completed college. So that's really all social determinants of health. That's really what we're talking about.
So what do places like Shepherd Community, what is it? What's necessary for us to move the needle on these issues?
Yeah, I thought about this. So there are a couple of things I think that you can think about, and I think we've talked about this. One is social determinants of health. The reason why it's important is, one, you can be able to start to control for health outcomes of your community. And let me jump a little bit into that. For example, if you are Shepherd Community, you live at a place where folks are having issues accessing, medication, or having issues accessing the proper care, or just don't have access to good, clean food. It's important for Shepherd to be able to partner, identify those, and be able to partner with health organizations or other government agencies to be able to start to address this. Because I think without that critical partnership, you lose the infrastructure required to be able to improve or move the needle on any one individual health.
So what would success look like? So one of them that I think you and I talked about, and we've talked with folks there at IU, is the infant mortality rate. Yeah. That Indianapolis, and particularly our neighborhood, is incredibly poor in this. So what does success look like in trying to tackle those issues?
Yeah, so there are a number of metrics, at least we track internally, and those tend to be the number of partnerships we are able to establish outside of our organization. So there's an organization, I'm forgetting the name, that we just recently partnered with. Success to us, the metric at least we track is, the number of essentially the number of lives we're able to impact. So for the Shepherd community, I would think that successes might look a little bit differently, because you guys are much closer to the action, if you will. So I think for you, it's looking at your community, not just infant mortality, but other sort of health indicators, looking at how you might be able to impact those, how you might be able to help somebody put food on their table, how you might be able to bring more, for people who are lonely, match people up to be able to have a conversation. I think the little things that, Jay, you and I don't often think about, because we don't necessarily have those barriers. The little things that you might be able to do to move the needle is much more impactful than sometimes what we are able to do as IU Health, as a huge organization, because we're only talking about the care delivery aspect of this. Meanwhile, you're out there, you are talking to people, you're helping them with access to food and everything else. So I think that's where that 80% is. That is exactly what success looks like. If you're out there touching people and helping them improve their health and well-being.
You said something that you said this a couple times out there. I think the challenge is it's no longer to come here for help or go to that. It's taking much of the services to where folks are and engaging with them there. As one final question, why does this matter?
Well, there's a number of reasons why this matters. So I can look at it from a health professional. For us, one of the topics that often we talk about is cost, right? Overall, we found that we're able to control about 30 to even 50% of the overall cost of care if we're able to properly address social determinants of health. That's one aspect of it, one aspect of that. The other reason is that, Jay, over time, and these studies has been done in other places, not Indiana, as you start to improve these social determinants of health, you start to reduce longstanding disparities in health and well-being. So we talk often about we often talk about health equity. But health equity is essentially, or health inequity is essentially, what social determinants of health or social impediments of health really is about, right? It's about addressing, transportation, access to food, that you are able to move the needle on a community health and overall well-being.
Well, I appreciate your time this morning. I know you're very busy, and you have helped us. You've listened to me and brainstormed with me multiple times, and I appreciate that. Appreciate your time today, and we're going to continue. I'm going to just take a moment to introduce our leadership team. Alan Sutherland is our Chief Pipeline Officer. Tim Sturgis is our Chief Administrative Officer, running the business side of Shepherd. It's been with us all of 5 weeks. Andrew Green's our Assistant Executive Director, overseeing our external partnerships. Edson Solores handles IT and HR for us and is looking for some applause, I guess. And Becca is our Chief Program Officer. Shane Hardwick is the world's greatest ambulance driver. He is our paramedic, and we're going to hear from him in a little bit. And Phil Edwards is our Chief Engagement Officer leading our volunteer effort. Tim Street is our Assistant Director, has been struggling down in southern Indiana with where he's finishing up his PhD, but teaches our Poverty 101 class. And I'm excited to have Dr. Charlie Miramonti. He's been our medical advisor these last couple of years in a time we know as COVID. Charlie, thank you for being with us today. And Charlie leads a team of medical advisors. Nambi has served on that for us as we brainstorm things. But Charlie, I have a couple questions for you this morning. Charlie has led at times the EMS for the city. It's actually through Charlie and I's conversations that Shane has ended up coming to join our staff and to work in a unique partnership. But Charlie, tell us from your experience of running an ER at Eskenazi and now in your role as medical director at Oak Street Health. Charlie, what is it that you see that makes it important for us to be having this conversation and the things that are important for a place like Shepherd to be engaged with?
Well, good morning, everybody, and thank you, Jay. In my time at Eskenazi, which has served as a safety net hospital for the city, as well as with EMS and whatnot, I think over and over again, one of the more common themes that I see as an ER doc, and even as in my physician exec roles in years past, is how low-hanging the fruit is, if you will, how doable these sorts of initiatives I think really are from a number of aspects. And just to sort of shed light on that a little bit, I can't tell you how many folks come into the emergency department for their primary care because they have nowhere else to get it. I can't tell you how many folks come into the emergency department sick for very preventable reasons, how many folks get admitted to the hospital because they didn't fill their medications, understand their medications, or didn't have access into any alternative preemptive or preventative measures. And, it's just, for lack of a better word, it's just dumb. The way we exercise the health system, or we fall back on the emergency department and EMS communities to solve these problems over and over again, rather than just go at it at the source. And but again, from the physician and experience standpoint, it just seems so doable and so frustrating that we can't solve for these things.
Good morning, everyone. Charlie, thanks again. Could you speak just for a moment on how originally the conversation between you and Jay, I know you were speaking about how frustrating, because it seems in some cases so simple to solve some of the things. How did the partnership with Eskenazi, EMS, and Shane result?
So that we did a years ago when the city had more sort of infrastructure around public safety and more data support. We did a decent deep dive on the communities that were high EMS, high public safety utilizers. So where were the majority of our phone calls coming from and whatnot. And what we saw was a number of areas, a number of neighborhoods that lit up as frequent utilizers. A lot of those calls, especially on the police side or law enforcement side and fire more than EMS, but a lot of those calls were unnecessary, were misuses of resources, were pulling away resources from other more pressing matters. A lot of the EMS transports that we were taking in there into the hospital, again solving for social issues, solving for access issues that you really didn't need an ER to do or an EMS agency to do. And so when we were able to sort of paint the pattern, we sort of took that, initially made the argument that, look, we're from a financial, I'm going to craft the argument for the purse strings, if you will. But from a financial side, it was easy to demonstrate we're pouring a ton of resources into these communities. We don't collect on this at all. We got a 9-12% collection rate on every dollar billed. It makes zero sense that we're continuing down this ridiculous fee-for-service model to just dump assets in there on an as-needed basis, rather than let's go spend some money ahead of time and let's go invest and see what we can do there and then. And so that's where the initial model came from. It was easy to make a case for funding at that point. It was also easier to write the check at that point. And then in years down the road, when everything shifted back over to more of a fee for service and consultants looking to lean everything up, you get back into the arguments of, hey, why are we spending money on these communities? And it's and unfortunately that is the recurring problem you have, I think, with many of the health systems today, and getting them to explain or getting them to understand the value of long haul investment. And I'll tell you the other reason that this was easier to do. I'd been in this role for a long time. I was organizationally attached, if you will, to Eskenazi. I wasn't going anywhere. Same with Jay. And you don't have that today with a lot of healthcare leadership. Even here with Oak Street now, and you look at the C-suite in most health systems, turnover is 2, 3, 4, 5 years tops for those folks. And so how folks define their success, they don't define it by the impact they've had on the community. They don't define it by the impact they've had on the organization and the city around them that supports them. They define it by the spreadsheets that they've got to deliver every Friday or every Thursday morning, whatever, in their reports. And they've got a bottom line they have to answer to. That's not an evil thing. It's not a wrong thing, but it's something that's got to be encumbered in the conversation so that we can figure out strategies around that down the road.
Charlie, where does a place like Shepherd intersect with this? Where do you see us making the greatest impact?
Yeah, I think Shepherd brings to the table the labor force, the trench, the frontline providers, the folks that are in the trenches every day, where I think organizations can leverage dollars relatively easily. Shepherd can actually turn those dollars into investment rather than just spend. You know what I mean? And being able to leverage workforce and being able to leverage time and talent, as well as relationships that are additive. I think that's the role that Shepherd plays. It's being able to pull in the networking, the political support, if you will, the financial support from other organizations that is cumulative. If you can get some folks to give just a little, you can amplify that quite a bit as an organization, the way that you're structured today. And I think that's the role.
So how do you feel first of all, it's partnership. And this has been a consistent theme as we've talked, that we're doing this together. We're not going alone. We're working with others. And so we've had this partnership, and Charlie was key. And now at Oak Street, we've had a partnership. We were able to do our first COVID vaccine clinic with Oak Street here. So let's hone in on what Shane does. How do you see our police officer and paramedic making an impact?
Yeah, it's a lot of the frontline work, and the work that your team does there is first of all, it's incredible, and you read the stories, but it is investment in the community. And when we see teams that can address long-term social problems with long-term solutions, things that take weeks and months to iron out, and take time and investment, that have a different definition, if you will, of ROI for the sake of that community. That I think is being able to leverage a huge win. And the work that they do is preventative. And if there are times when it's preventative and who's going to go to the emergency department or not, there's times when it's preventative and that they're solving long haul problems that have been there for years or months and really take years or months or weeks to work through. And I've seen that over and over again with that team. It gives you resource support in the neighborhood. It gives you eyes on in the neighborhood. It's an ally for the public safety providers that come into those communities. It's a tremendous liaison role that is I just can't say it over and over enough. It's just a huge win.
Yeah. Dr. Miramonti, if you'll hold on for just a few moments, I want to talk to Shane, and want to be respectful of your time. So if you need to go, I understand. I appreciate you giving us time this morning. Shane, can you tell us what a typical day looks like for you and your IMPD officer. Officer Adam is a reserve officer, and we pay his salary, and we share your cost with Eskenazi EMS. But Shane, tell us what a typical day is like for you.
Sure. Yeah. First off, it's world's okayest ambulance driver. So our day, we meet in the morning and just start looking over our notes from the day before and figuring out what do we need to do, what's highest on the pecking order, and then move down from that. So no day is the same by any stretch, but there's definitely a theme to what we do. And we start looking at runs pretty early on. It's a busy area. It feels like it's slowed down quite a bit in the neighborhood. But we start looking at runs. Sometimes I'll pull the CAT information from the week before and see, okay, where are our top callers at? Most of those are public buildings. But occasionally there'll be a house that'll pop up that it's like, why do we keep going back? As the 911 calls start coming in, we're also getting referrals from police, fire, EMS. Hey, we need you to go get eyes on this house. This is what's going on, and this is what seems to be the problem. All very common theme with poverty, as you say, Jay. Poverty's ability to restrict people's ability to navigate. So as the calls start coming in, we're looking at the CAT information. Has fire, EMS, or police been to that house in the last 30 days? That's kind of one of our jumping off points. And if we've been there, then we'll back onto the run and just kind of go see what's going on to kind of poke our nose in there. One of the things that I think is kind of overlooked in the same vein as social determinants of health is that if you look, there's no busy ambulance area that's not a busy law enforcement area as well, with notwithstanding senior communities or nursing homes. But for the most part, if it's a busy law enforcement area, it's a busy EMS area as well. And what we found is that the social determinants of health are also contributors for crime. How you were raised, who you run around with, what's normal activities for you. So finally realizing that we've kind of identified that the contributors of crime are the same thing that are the contributors for poor health habits. So once we get on the scene, if I need to render emergency care, I will. But for the most part, I step back. I let the fire and EMS guys do what they do. And I'm kind of working in the background, and Adam as well. Adam, if you don't know Adam, if you're on this call, he has the gift of gab. He's really good at getting in there and talking to family, and we're figuring out what are the problems, what led up to this call. And one of the most empowering pieces that we have in our arsenal is that at the end of that call, we're giving people our business cards. So now they don't have to necessarily call 911 for the minor issues that are impacting their quality of life. People that may have not have ever had a voice before now have the phone number of a paramedic and a police officer that they can call if they have a question regarding any kind of legal issues, if they need their blood pressure checked, they can't seem to get a hold of their doctor, they can't get their medication. They know that they can call us, and we're gonna come alongside them, and we're gonna help build that relationship and help them overcome whatever barriers they have.
Shane, I just quickly, if you could tell us the story about the individual who would call. The average was every 22 hours he was calling 911.
Gosh, I know. Gosh, Jay, we deal with a lot of people. I know exactly what you're talking about, but I can't remember.
When we averaged out his time that he was incarcerated or in the hospital.
Yeah. So we had a gentleman that for years was a fixture on the east side of Indianapolis. He basically, you'd see him every day at 10th and Linwood begging for money. And then every day he would be in an ambulance, at least once a day. The fireman didn't mind him because he wasn't calling at night, so he wasn't waking him up. The EMS folks, he's a cool guy. We just put him in the airway chair and buzz him over to Community East. The nurses, they really didn't mind him. Most times he's the only guy that knew where the break room was at, would go fix himself a cup of coffee. hang out in the waiting room for a while and then leave. And so, the police didn't really mess with him because if they ran him, they knew he was going to have an outstanding warrant and they didn't want to lock him up. So everybody just kind of was status quo with this gentleman. And once we started looking at him, we realized that he was running the same route every day. He would stand at 10th and Linwood, beg for money, and until he got enough money. And then he'd call an ambulance, go to the ER, get a cup of coffee, get a sack lunch, and then would then walk down to the liquor store, get his liquor for the day, and then go back to 10th and Linwood and repeat cycle every 22 hours. So we did some digging. He had a ton of money through SSI that his payee fired him. So we tracked down the payee, figured out why she didn't want to give him any money anymore. She says that it broke her heart to track him down, give him all this money every month, and then the next day he's back out begging for money. Couldn't remember what he did with all of his cash that she just handed off the day before. So once we get to digging a little deeper, the ER was releasing him awake, alert, and oriented. They said he's completely fine. Well, no one was really spending any time. He was very conversational about much of nothing. But once you started asking pointed questions, it became very obvious very quickly that he had no idea where he was at. He had no idea what year it was. He had no idea that he'd went to the hospital 22 hours earlier. Another organization had come in and rented him an apartment and furnished it and put a bunch of stocked food in his pantry. They put him in for the night, patted themselves on the back, and then they just left with no follow-up. He got up the next morning, walked out of the apartment, never came back. Not because he didn't want to have a roof over his head, but because he couldn't remember where the apartment was at. So we had a guy that was racking up, and I think we did the math. It was costing tens of thousands of dollars a month for this man to be homeless. So we finally got him in, and it took a while. It took a long while. We finally get him in front of a psych doc. They did an evaluation on him and found him incompetent. And so now he's no longer living on the streets. He's living in a memory care facility at a senior center. He's getting a warm bed to sleep in. He's getting, 3 hot meals a day. People care for him, and he's not living on the streets, utilizing a bunch of resources.
Shane, we appreciate what you guys do each day. We talk about that Adam and Shane, our police officer and paramedic, are the tip of the spear for the rest of the services that we provide. Everything at Shepherd's integrated. There's no one standoff. Becca, who's our chief program officer, could you just give us an idea? We've just completed in October campaign to provide flu vaccines. Tell us a little bit about that and how many we were able to do, how many childhood vaccines, and maybe also how many COVID vaccines we were able to do with our different outreaches.
Yeah, so all throughout October, every Monday, we were providing flu shots for people in the community. In the morning time, Shane and Adam and myself and another paramedic would go to senior living centers. And then in the evening, the late afternoon through early evening, every Monday, we were doing a drive-through clinic on Shepherd's property. And so throughout the month, we were able to do 232 flu shots and provide to our neighbors that opportunity to come and get their flu shot right here, or in the case of the senior centers, right where they lived. We went to 5 different senior centers throughout the month. And then it was really fully staffed by paramedics. IEMS was really the main partner for that, and they provided the shot givers throughout the entire time. And then we did have some volunteers who came to help translate and who came to help with paperwork and things like that at times as well. And that was really cool to see all of that come together. And then over the summer, as Jay mentioned, we had 4 separate COVID vaccine clinics, 2 Moderna, 1 Pfizer, and the one Johnson & Johnson, where the Johnson & Johnson one was a door-to-door out in the community as part of a larger push of needs. We were asking about food. We were asking about other needs they might have, school, after school care, things like that. And then being able to give the shot was one of the opportunities for that outreach as well. And throughout all 4 of those, we were able to get 166 individuals fully vaccinated as well for COVID. The childhood vaccines that Jay mentioned, they were the last 2 Mondays in October. We had the opportunity to school-based vaccines, so children who need the specific vaccines to go to school. And we were able to vaccinate, I believe the number was 19 children total, but many of the children were getting multiple vaccines as well. And so that was our first year doing that. And so we did that in partnership with the health department. And so they provided us an individual and for those 2 weeks, and we were able to provide a variety of vaccines to the children. Some of them were childhood flu shots, and then, hepatitis, all those types of things as well. We're getting vaccinated for 2 of the Mondays in October as well. And so that's the overview of the vaccines we've done.
I believe it was over 50 vaccines we were able to provide to the 19 children.
Mm-hmm.
One day I saw one of the little guys that had gotten 6, and he was not in a good mood and did not appreciate our outreach. His parents did, but he was not in the mood to thank us. So these are some of the ways that we're trying to move the needle. We also have a partnership with Crosswinds Counseling and New Day Addictions Programming. We know that mental health is a key part of this as well. And we are trying to expand our services and work with a growing issue. There's a thing called ACEs. ACEs is adverse childhood experiences. You would think of it as PTSD for kids. Those scores have increased through COVID. We have tested, Tim Street has helped us with the Children's Hope Scale and looking, and we know that those scores have gone down through all of this. And so we are trying to be aggressive and expand our partnerships with others so we can bring more services to bear on our neighbors. We're in this crazy conversation with USC in Southern California and Purdue to take a lab that works at USC and a virtual reality program that they have created for the military to help reduce PTSD in members of the military, and see if we could partner with Purdue, who has some experts in ACEs and childhood trauma, and bring that to Indiana and make it available through virtual reality to youth serving organizations. It's a big dream. It's a lot of money. It's about a $5 million project, but we're talking with the state. And it's that kind of creativity that it's going to take for us to continue to move the needle. As you've heard from Nambi, from Dr. Miramonti, from Shane, that we are trying to be creative and have an impact into the life of our neighbors. So what does 22 look like for us? We are moving forward with one of the greatest needs is transportation, medical transportation. And so we are working with the state to become qualified to provide medical transportation to our neighbors to make sure that they get to their appointments or dialysis, which almost 50% of the transportations from our 2 zip codes, the 46201 and 46203, end up being around dialysis. I think, Shane, you could tell us from your own experiences that many times you receive phone calls because the taxi never showed up, and it's important for folks to get to their appointments. And so we believe that this is a way for us to be able to help improve the medical care. Shane, how often do you think you hear something about someone needing help with transportation?
Every week. I had a lady from the 205 reach out to me yesterday who's got brain cancer and her car needs repaired. So we repaired one lady's car a couple of weeks ago, last week, that had 4 children, and her Her brakes worked some of the time, quote unquote. Through some compassionate funds, we were able to not only, and this was a relationship built with a frequent 911 utilizer. She introduces us to a lady down the street who she's concerned about some postpartum depression. We start unwrapping that, figure out that her brakes are metal on metal. She's got 4 small children, that the car stops some of the time. She needs a job. So we've started pushing her towards a career at Shepherd, and we were able to get her brakes fixed. And so within days, I have a lady who's on the north side who all of a sudden is calling and saying, "Hey, I got your number because I heard the great work you do." So the long and short of it is, yes, every week we're hearing of some sort of transportation issue. The health system is designed historically to bring the patient to the doctor. And we're chipping away at that with telemedicine and everything else. But if people don't have reliable transportation to the doctor, the whole thing, it's a cascading effect of issues. So the cab companies that are out there now are notorious for people who have been waiting to see a specialist for 4 to 6 months, and the cab shows up an hour after the appointment, or they don't show up at all. So medical transportation is extremely unreliable. Not pointing fingers, not bashing. It is what it is. And so it's the same story over and over and over again, where it's like, I've been waiting for this doctor's appointment. I was there, I was out front, and they never arrived.
Well, the exciting part of this is the average trip is about 6 miles, about 15 minutes. But if we were able to provide that transportation and folks could choose us to be their provider, we pick them up from their appointment. One, we make sure they get there on time, and then we pick them up and are able to say, okay, hey, what did the doctor say? When's your next appointment? Do you need medicine? Hey, could you use food? Are you looking for work? It opens the door, just like the food delivery does, to bring additional services to bear for our families. And so we'll continue. It's about a 90-day process. So we're looking sometime in the first of the year to begin to be a part of that and help our families make sure they get their medical transport. We want to take any questions if anyone has anything in regards to this. Dr. Miramonti and Nambe, we appreciate Alaze for joining us today. And they've had to move on. But if you have any questions, feel free to ask. I'm going to ask while we're waiting. Phil, share with us about volunteering.
Yeah, I want to thank all of you who are on this call as you explore ways to engage in the kingdom work at Shepherd. And as you've heard, there are many challenges that our families experience. But nonetheless, Shepherd is in the trenches, meeting their needs with the help of our partners. And we have opportunities for those of you who are interested in serving alongside of us. We're limited in our efforts because the needs are so great. And so just a list of ways that you can help impact our neighbors' long-term health care are these. So volunteer at our medical clinics. You've heard about what we've done in engaging our neighbors and providing the vaccines to them. And so we can definitely use more help as we have future medical clinics. Call our neighbors and review their e-meds. And again, you can learn more about that when you check in with us on those opportunities. And lastly, check-in calls and transportation. You heard that. Calling our neighbors, checking in on them. We know that it is important for us to establish relationship with our neighbors, and we want our volunteers. We want volunteers to help us do that. People are lonely. People are disenfranchised. All of the challenges they face, they need someone to care. They need to know that their lives matter, and this is a way that you can help in that regard. And again, providing transportation. If you are interested in serving in any of these ways, you have more questions about serving in this regard, feel free to call us at our office here and call Donna Alexander. She's our volunteer director, and that number is 317-357-0203. And if you did, Jay said no. Did I miss something?
375.
I thought I said that. Okay, 317-375-0203. And if you want to reach out to her via email, her email address is Donna A, as an apple, at shepherdcommunity.org. That's Donna A at shepherdcommunity.org. Thank you so much for considering partnering with us in this regard.
Yes. And if you've heard ways, one of the things that Shane does is we, for some of the televisits, when our neighbors need to do that, we have iPads with air cards that we're able to go and help. There are financial issues. We help folks that sometimes need in emergency ways. You heard him describe whether it's fixing a car or getting some medicine. I talked to him yesterday, and he was in the pharmacy getting some medicine for our neighbors. Sometimes there's snafus, and we know they need their medicine. Sometimes the working poor are really in a dilemma because their benefits don't match up to sometimes their needs. There's a variety of ways that you can help, and this medical transport is one of the more exciting things as we look into 2022, and the continued expansion of our counseling and mental health services to our neighbors, our other areas. So we appreciate, thank you so much. We're on the road to recovery. Won't you join us?